And I just want to welcome and thank everyone for attending this important session entitled Real Talk and Trusted Advice, COVID-19 Vaccine Community Forum. This forum is especially important to our faith community because you will receive accurate information based on science that also honors and respect that we are people of faith. That being said, we'd like to open this session with a word of prayer from Dr. Jonathan Butler. Dr. Butler, are you there?
Yes, thank you. And let us pray. Oh God, we thank you for this day. We thank you because you are a God of all comfort. And we want to take the time out to pray for those who have been, who are, or who will be affected by all that encompasses COVID-19. The physical, the mental, the spiritual, the emotional, the financial burdens are great, and we know it. And we know that not everyone is affected equally or justly. And so we pray especially for those who are risking their lives for the protection and sustenance of others. And we pray that you would help us to lift up the voices of those that are often unheard. We ask that you would look upon those who the world tries to look away from, and that we know that you hold all truth, and that as we come together today to seek truth, we ask that you would give us clear understanding, that you would open up our hearts and our minds to receive information, and then give us guidance thereof so that we can go and do what's best for not only ourselves, but our community. We thank you for this day again. In Jesus' name, amen.
Amen. This session is a partnership between UCSF and the San Francisco Foundation. At this time, it's my pleasure to introduce Michelle Mosley. Michelle is lead health educator in the Helen Diller Family Comprehensive Cancer Center, Office of Community Engagement. She's going to be thanking and introducing her partners. Michelle?
Yes, good afternoon, everyone, and thank you for joining us. I'm going to briefly share some acknowledgements today. First, we want to thank our two speakers who will be presenting to us today, Dr. Kim Rhoads from UCSF, Dr. Jonathan Butler, also from UCSF. We also want to give thanks to our Abundant Life Health Ministries Network, Faith Communities Committee Leadership, who have played a role in planning today's event. That is chaired by Sister Wilma Batiste of Neighborhood Baptist Church in San Francisco, Sister Marian Harris of Glad Tidings Church in Hayward, and also the NorCal jurisdiction of the Church of God in Christ, and Dr. Corinne Holder Jackson, who is co-chair of the Abundant Life Health Ministries. And then we also want to thank Sister Nicole Pope and Sister Cassandra Bailey, who lead the Healthy Temple Ministry at Acts Full Gospel Church in Oakland, California. And with that, I'm going to turn it over to Michelle Miles Chambers for some additional acknowledgements.
I don't know if Michelle has joined us yet, but Michelle is the Faith Senior Program Officer with the San Francisco Foundation. And she leads, as we all know, a wonderful Bay Area-wide faiths leadership group. And she has invited that group today, and we want to thank all of you who are part of it and are joining us in this session. There are two segments during which our physicians will answer questions. The first segment will address your pre-submitted questions. When you receive the flyer, you were asked to submit any questions that you had and any questions that your communities may have, and then those were in turn submitted to a group of us who looked through them and gave them to our physicians. And so our physicians have seen some of them and have selected some of those questions. After they have answered those questions, we're going to open a Q&A box. And for those of you who did not have an opportunity to submit questions, you'll have that opportunity in the Q&A box as time allows. We're going to keep moving forward because we want to use all of our time, as much time as possible, to answer those questions. I'm going to start by introducing our amazing speakers. Our speakers are Dr. Kim Rhoads and Dr. Jonathan Butler. Dr. Rhoads is currently Associate Professor of Epidemiology and Biostatistics at UCSF School of Medicine. Although she no longer practices clinically, she is double boarded in general and colorectal surgery. Dr. Rhoads holds a master's degree in public health from the Harvard T.H. Chan School of Public Health, where she studied healthcare policy and management with an emphasis on minority health disparities and leadership. She founded the Stanford Cancer Institute Community Partnership Program, now called the Community Outreach Engagement, and now serves as the Associate Director of Community Engagement for the UCSF Helen Diller Comprehensive Cancer Center. Dr. Rhoads earned her MD from UCSF School of Medicine and a master's degree in health and medical sciences from UC Berkeley. And as I was watching NBC television the other day, there was an announcement that popped up and I was so excited. I have it here on my phone. But there was a shout out on NBC to Dr. Kim Rhoads, NBC Black History Changemaker. And I started cheering and my family started cheering because everybody, can we just like do some praise hands here for Dr. Rhoads? We're so excited to have her. And Dr. Butler is a research faculty member in the Department of Family and Community Medicine and the Center for the Study of Adversity and Cardiovascular Disease, the Nurture Center at the University of California, San Francisco. Dr. Butler serves as an associate minister at the historic Third Baptist Church of San Francisco, an extraordinary church, and the executive director of the San Francisco African American Faith-Based Coalition, a coalition of 21 San Francisco churches committed to eliminating health disparities. Now, at this time, Michelle Mosley is going to direct the questions that we've already received to the physicians. And so I'm just going to pass it on to Michelle. Michelle, thank you very much.
All right, thank you, Carmen. Here we go. Ready, Dr. Rhoads and Dr. Butler. We're going to start out with a first series of questions that we received in the area of mistrust. And this can relate to mistrust of the government, mistrust of the healthcare system, public health, etc. So I will ask the question and feel free to take it from there. First question is, what can we do to increase the level of trust about the vaccine among racial and ethnic minorities?
I'll start. Thanks for having me. I would say one of the biggest things that we can do is withhold judgment for people who don't want to take the vaccine, and provide an opportunity and access, just like this forum that you're creating now, to have a dialogue with the community so that people can actually make a decision for themselves. But what we want is for them to make a decision that is informed by facts rather than by conspiracy theories or things that people have heard on social media. So really it's about creating a relationship and being in dialogue, in my opinion.
Yeah, certainly agree with that. For me, it's to first acknowledge the flagrant abuses of the past and even the subtler ones that are happening in the present. And then basically telling the truth. There are some things that we know about the vaccine and there are some things that we don't know about the vaccine, and just being honest and dispelling a lot of the myths, because we know that there's a popular argument around medical experimentation in the African-American community, and it's often dictated by culture and politics. So I think this forum is a way for us to, as Dr. Rhoads has mentioned, is to provide as much information as we know, and then allow everyone to make an informed decision on whether or not they want to take the vaccine.
Okay, thank you both. Next question. Is it possible that a separate vaccine could or would be given to Black people for experimental purposes?
So to say it is absolutely impossible would, I think, be an overstatement for me, because I don't know if there are people out there who would, perpetrate this kind of fraudulent behavior. However, the vaccines that you're hearing about on television, through the news, the ones that are in development, the ones that have been given FDA emergency use authorization approval, are approved through the scientific rigor of clinical trials and all phases. Even though we had this name Operation Warp Speed and people think that they sped the trials up, they didn't. And then once they're done going through trials, they then have to go through a full evaluation by the FDA. And that's a panel of experts from across the country and potentially internationally. So it would be hard to influence them, for example, with money from the pharmaceutical companies. So in order to keep yourself safe from a vaccine that may be fake, which is very unlikely, you just need to ask, what vaccine are you getting? Does it have approval from the FDA? And then once you get your vaccine, you will be given a card that has the name of the vaccine, the lot number of when it was produced, and a date of when the vaccination was given, along with some other details. So that's your documentation of what vaccine you actually got. But if you're feeling skeptical, you should ask the question, what vaccine is this? Is it FDA approved?
Yes, and I certainly agree with that. As we know to date, there are two vaccines that have been approved, the Pfizer and Moderna. As Dr. Rhoads has mentioned, it goes through phases. I think this question also sort of in the back of my mind, I get a lot of questions about whether or not we'll be the guinea pigs. In this particular instance, like the Pfizer and Moderna, I want to share that it does go through these phases in clinical trials. And in each of these clinical trials, I know in Pfizer, there was roughly 44,000. In Moderna, there was roughly about 30,000 folks that were enrolled. We know that most of those are sort of whites, but there are 10% in both of those trials that were African-American. And in Hispanics, there were about 13% in Pfizer and 20% in Moderna. So this is a rigorous process that has actually, asked folks if they'd be willing to participate, and they've, given consent. And a lot of folks say, we'll be the first to get the vaccine. Well, the case is that it's gone through this rigorous, clinical trial, and it has been tested in thousands of folks before it even can get into the public. So I just wanted to make sure I addressed the guinea pig question.
Can I just add to that? Because I think you're right about this fear of being first. And the reality is, at this point, some 22 million people have been vaccinated. I think we're close to 10% of the country has been vaccinated. So technically you're not first. And you will have an opportunity to see how those folks do and to hear the stories that you may be concerned about as they emerge. And since you haven't heard a lot of stories, I just would want to emphasize that that there haven't been a lot of events that are negative as far as the vaccine goes. So you won't be guinea pig because you're not first.
Okay, thanks for clarifying that and clarifying about whether or not there's a separate vaccine for that people of color are getting. So the next question is related to, well, the question is, does the vaccine leave markers that can be detected by scans so that a person receiving the vaccine can be monitored or tracked? Again, this is in our theme of questions that fall under mistrust.
Yes, so I can just say, I get this question a lot, but it's asked differently. Is there a microchip in the vaccine? And the answer is no. And then I always like the analogy that Dr. John mentions when we get this question is, this is your microchip here in your phone. If you recall, every time you search on some website, then you immediately go to social media and you'll find the advertisement of what you searched for on the website. So, I mean, it's tracking more of your information than obviously the vaccine, because the vaccine does not have a microchip. So I just wanted to say that.
Yeah, and your phone tracks where you go too. And if you get into the metadata inside your phone, you'll see that it knows exactly where you've been for the last year or 2 years, however long you've had your phone.
Wow.
So true.
Scary. No. All right. Another question that we have before we transition to our next series of questions is it true that hospitals have robots that can locate people who have or have had COVID-19?
I actually had not heard this one, so I did look into it, and it's possible that what the person or people who asked this question are referring to is there is a robot that is being developed in collaboration with between Israel and China. But what the robot does, I think it's a bit oversold. What it does is it has the ability to detect symptoms early on. So the slightest symptom in combination with other information that the robot is given, the robot can say, oh, this person maybe has COVID. But it's still in development, and it's not detecting the virus in your body. It's simply detecting using algorithms to determine COVID versus not COVID using symptoms and would report.
And I know that we're headed to the next topic, but I think this is so important in terms of mistrust, is to affirm and articulate that there has been a long, unhappy history of medical research with Black Americans all the way into enslavement, and that a lot of times we focus our conversation around the hesitancy of Blacks of taking the vaccine, but I hate that. I think that we rather should focus our attention on the untrustworthiness of the American medical research sort of system, especially when it comes to studies involving Blacks. So I think it's important to understand that there is legitimate concern that African Americans have, but also want to note that the worst abuses are memories now, that even though there's some, there are, abuses that persist, they're not to the level of the offenses that were with our ancestors. So I just wanted to make sure that I acknowledge that.
I just need to piggyback here, because I think part of the most egregious offenses that are very easily things you can point to and say that was obviously wrong, those are done. But the subtle slights that happen in the healthcare system, having chest pain while Black, right? How long are you going to have to wait in the waiting room with that before you get some attention, being accused of being drug seeking? These are things that I think influence the everyday experience of African American people with healthcare systems. And one thing I just want to point out, that it puts us in a terrible position, right? Because nothing is really ever for us deliberately or intentionally. It's rare. And so when somebody says, okay, this is for us, and I can give you an argument for why it matches with what our experience with COVID is, but just say it is for us, then it looks suspicious because nothing is ever for us. So then we're trapped, right? When maybe it is for us, but then how do we figure that out? Because that's not normal. And so that would, gin up the mistrust that would go along with, yeah, the Tuskegee experiment was for us, right? It wasn't what we wanted. So I just would kind of think about, what does it look like when we find out something is for us and we actually pursue it, and see what does that feel like? Because being Black in America, that's not the typical situation.
Totally agree.
All right, just a kind of a two-part question to round out this segment. And I know you've already kind of alluded to this embedded it in a previous question, but I just want to give you a chance for the record to ally this for the persons who submitted this question. And their question was related to feeling like there is a pressure and a rush to vaccinate people right away. And they go on to say that are pharmaceutical companies paying doctors, politicians, researchers, celebrities, and others to push and promote the vaccine is safe? So if we can kind of clear that up.
Pharmaceutical companies have in the past, and probably to this day, do still pay people to say what they want them to say. With these vaccines, it's a number of different companies. And so as far as is visible to, to the public eye, I haven't seen celebrities hawking a specific, get the Pfizer vaccine or get the Moderna vaccine. They may be saying get vaccinated. And as far as the researchers go, I did make reference to that on the FDA committee. Maybe you could bribe one person, but the committee is huge. So that one person may not have any influence over what comes next. And I do agree that there's an urgency, and it's a public health urgency to get the pandemic under control. But the reality is the vaccine's not going to be available to everybody right now. So even though we're talking about it like vaccine is here and you should get vaccinated next week, the reality is not everybody is eligible to get vaccinated next week, the week after, next month. Some people's turns won't even come until mid to the end of 2021. So it feels urgent because of the public health emergency of COVID, but it's not actually because we're trying to vaccinate everybody tomorrow.
That's well stated.
All right. Did you have something else, or do you want us to?
I think we can move on.
Okay, great. All right. So now we have a few questions related to faith and science. So the first question is, why is the faith community's role and voice urgently needed during this pandemic?
Well, certainly it is. So the faith community provides a source of solidarity. The faith community is able to identify the needs of the communities and actually meet their needs. That's just been something that we've been able to do even prior to COVID. And the other thing is we have, it's been my experience that we tend to be, particularly faith leaders, we tend to be first responders. So before people go to their doctors, they tend to check in with their pastors. At least that's been my experience at my church. And we've always been this sort of source of information and authority, that even though that authority sort of differs across geographies, but we sort of have the ability to influence the public to at least listen to the healthcare recommendations. I sort of, use the pulpit as a way of providing information, but also the faith community provides meaning. And what I mean by that is that that there are, spiritual needs, there are emotional needs, and there are also physical needs that folks need. And so I know that during this COVID experience with the coalition, we've been able to provide, for example, meals to seniors and families with children. We've been able to refer folks who are going through some sort of mental crisis, job loss. I mean, you name it. And so the faith community has always been that voice of compassion, that voice of hope and truth, the voice of dissemination of information, and just providing the true needs of the people. And it's just heightened and during this time. So I think we certainly is essential that the faith community not only maintains its relevancy, but what I've found even in this experience of our communities, our faith churches coming together to meet the needs of the community at large.
All right, thank you. The next kind of part or related question in this area is how do we resolve and address conflicting messages or conflicting beliefs, such as we should have faith over fear, we should trust the science, God is in control, and people are feeling a bit of conflict that it's either faith versus science, or faith only, or science only, and just how would you address that question and resolution around those issues?
When we, the definition of faith is, or the definition that we know is faith is being the substance of things that we hope for, the evidence of things not seen. And even in science, I mean, as it relates to the vaccine, there's some things that we don't know. So there's a level of faith that we have even in the science, as scientists actually have to have this type of faith. And, faith is basically risk. And so I think that in our journey in life, there are things that we hope for that we just have not seen, but we still have that hope, and we go about our day with the assurance that it is to come. But the reality is no one's gone to heaven and come back and told us about it. And so just as we have faith in our spirituality, we certainly have to have faith in our in the science, and that's basically what it is. It's really, and you can probably make that argument for in all of the sciences, that there are things that we won't know until we know, and that is the first faith journey. It's the faith that empowers us, it liberates us, it tells us to go instead of just staying and not going. It's that that risk that we take, and there's never been a time where faith and science have sort of meshed, and that we're all anticipating on something that we've not seen, but we're hoping that it will run its course, and that that we will get what we desire. So
science can offer some, I think, hope to and support of faith by collecting numbers and asking a question. Of the people who have gotten this vaccine, how many people have we seen get COVID, severe COVID, and pass from that? And where we have, very small numbers compared to the large poor outcomes, compared to the extremely large numbers of people who have been vaccinated, including those who are on trial, the 22 million other Americans. That's where you can start to get a little bit of evidence that can, I think, bolster your faith in the science.
Okay, well, thank you for those responses. Our next set of questions are going to get into some details about the vaccine, as well as the safety of it, and how effective the vaccines are. So the first question is taking us to ground zero. What is a vaccine, and what does it do?
I will let the physician go, and then if I want to add something, I may or may not.
So a vaccine is a formulation that you can take either in a shot, or it can be given orally by mouth. The polio vaccine was oral. And what it does is, once it's inside your body, its job is to generate and motivate your body to create immunity or antibodies to the targeted agent. So what's given to you to stimulate that is not the agent itself, but some piece of the agent, so that it's kind of like giving your body a facial recognition machine. So it's saying, when you see this particular item is circulating in your body, it's not you, it's bad, and it needs to be neutralized. So please send the antibodies to neutralize it. That's what a vaccine is.
All right. Thank you. So the next question is, if I were to take the vaccine, what actually is in it that's going into my body? This question is related to what are some of the substances that are in the vaccine?
So I don't know what all of the what we call the inert ingredients, sort of the support liquids that are in there, but the thing that's going in that's important is, in this case, for Pfizer and Moderna, and then we can talk a little bit about Johnson & Johnson, which seems like it's coming next. What you're getting is a small piece of what's called mRNA. And what that mRNA is an instruction for your body to create some DNA. Why would we want it to create some DNA? Well, the proteins that your body produces, even for your hair, your skin, your nails, etc., that comes from an instruction booklet that is called DNA. So in the Moderna and the Pfizer vaccine, what's happening is there's an injection of a small piece of mRNA, and it's surrounded by a fatty layer to protect it so that it can get far enough into your body to get the reaction going. The mRNA tells your cells to generate DNA that look like part of the virus. And remember, as I just said, when your body makes things that are foreign, the reaction to it is to make antibodies. So once the mRNA stimulates your body to make DNA of viral particles, your immune system goes, oh, no, that shouldn't be here. We're going to make antibodies against that and neutralize it. So what's being injected right now is a small piece of mRNA. When the Johnson & Johnson vaccine comes, the way they get the genetic material into your cells is in it's a virus called an adenovirus, but it's dead. It doesn't really have any function. But what it does is it carries the genetic material that will tell your body that there's something foreign here and you need to make antibodies against it. So both of these, the Moderna and Pfizer, which are the cold vaccines that you've heard all about, the cold chain management. And then the next one that's coming, which is Johnson & Johnson, is not cold, doesn't have to be cold. What they're both doing is putting a little piece of genetic material into your body to get your body primed to make neutralizing antibodies, to rev up your immune system against the things that look like the coronavirus. And in particular, it's against what they call that spike protein, which is the key that the coronavirus uses to unlock your cells and get your cells making new coronavirus. So if your body recognizes it, the way I think of it in my mind is your key to your house unlocks the door very easily. But if you wrapped a big old piece of bubble gum onto your key, it wouldn't fit in the lock, so you couldn't get in your house. Antibodies are like that big piece of bubble gum. As soon as they see that key coming that they know is associated with coronavirus, it's going to gum up the works and block its ability to unlock your cells and cause an infection.
Yeah, I oftentimes talk with my cousins, and the first thing that they explain to me about the vaccine, that it changes your DNA. And so I do want to make mention of like the mRNA and how it's not able to change a person's genetic makeup, and it doesn't enter into the nucleus with the cytoplasm, which is outside of the nucleus. So that means that it does not, or is not able to affect or interact our DNA in any way. And I think that's a lot of, I get that question a lot in terms of mRNA and DNA. And I know that we're going to talk about that a little later, but I wanted to make mention of that.
Oh, yes. Thank you for clarifying, because yes, someone did pose a question about if their own DNA could be altered from the vaccine. But I think you've captured that essence of that's not happening. So the next question is related to the vaccines that are available. And the question is, can I choose which vaccine? I would prefer to have.
Yeah, you cannot choose the vaccine. It depends on where your provider, if you're getting it from your primary care doctor, or if you're getting it from the public health department, or if you're getting it from a community site or a community-based organization, they are given the kind of vaccine that the county has available. Your primary care doctor may prefer to give the Pfizer vaccine, so they will order the Pfizer vaccine from the state. The county and the community-based organizations and small clinics, they get whatever the state has available at that time to meet the number of vaccines that they have ordered. So you don't really get to have a choice. Now, when Johnson & Johnson comes around, your primary care provider may be offering Johnson & Johnson as a single shot vaccine, or offering Moderna or Pfizer as a shot that has to be taken twice.
And I'll add that both the mRNA vaccines are pretty much made the same. So I know that, I've had conversation even with my family that they'd rather have one or the other, but they're pretty much made the same.
Mm-hmm.
And their effectiveness is also pretty close to equal, also against the new strains that we've been hearing about.
Okay. There was one other kind of follow-up question some people had related to the current vaccines that we have. And the question is related to, since we know that Pfizer and Moderna are in the 95% effectiveness range, why would someone take the Johnson & Johnson that would be in the 70% efficacy? And so they would like to know why it's troubling to them that you can have something that's in the 95% and then something coming that's only in the 70%, and why would someone want to take something that's not as effective?
Yeah, that's a completely valid question. And I also think that's an opportunity, that's a place where, because we've talked so much about Pfizer and Moderna, and there's been so much news around it, that when you're being offered Johnson & Johnson, you're going to be like, wait a minute, this is a kind of a bait and switch. That one's 95% effective. This one's only, 86 after, several weeks. And what I actually learned yesterday with Dr. George Rutherford's, maybe it wasn't yesterday, maybe it was last week on Friday, talk about vaccines and COVID, et cetera. What he told us is we actually got spoiled, because Pfizer and Moderna with these 95 and 96% efficacies are actually abnormal. Our usual vaccines, and he compared it to the polio vaccine, 50% efficacious, but it's still eradicated polio. We no longer have polio, and it's because of that vaccine. So I know that sounds fishy, but the reality is 86% and 70% and even the 57% against the South African variant is actually better than what we've had in the past. I was surprised by that.
Yes, and I also want to note that all of which are preventing persons from having moderate to severe cases of COVID or even dying. And I think that's ultimately our goal, is to save lives. And each one of these has a potential of doing that.
Yes, thank you for clarifying that. Okay, so there was a mention, just a brief little mention of variants. The question that the person posed is, what are variants? You've already addressed the second part of their question, which was, will the vaccine protect me from that? So we heard you answer that part, but maybe take one step back and just kind of let people know what is meant by variants.
So variants are what we describe, or what we use to describe virus that doesn't have exactly the same sequence as the original virus. That we, started treating, that the sequence of that viral genome or their genetic material was used to create the mRNA vaccines, for example. And in this case, what I want people to visualize is a zipper. So as you know, if you have like one tooth missing from one side of your zipper, it just doesn't zip up. The little flanges don't fit together nicely. So DNA is two strands of what you could think of as two sides of a zipper. With these variant, and when there's replication or when the virus reproduces itself, it has to make that same zipper over and over, and it has to be perfect because those genetic material, the DNA molecules, have to fit snugly together. What happens with the variants is that they may have one tine missing, or one tine is green instead of gray like the rest of the zipper tines. And so that one little difference in that pairing is what's called a variant. Now you might think, well, that's just one minor change in the virus. How does that translate into something different? And what it is that DNA, as I mentioned before, gets made into protein. And protein is the thing you can touch, the thing with form and function. And so I'll give you an example of one of the first variants that was described about COVID. You know, we talked about these little spikes that they have. When in the early part of the pandemic, those spikes were rigid. They were like kind of brittle. So when the cell made a bunch of virus, your infected cells making a bunch of virus, and then releases those virus out of the cell, because it sort of just explodes open and virus is extruded, those spikes used to break off. And that was a good thing because remember, the spike is the key for it to infect the next cell. But if the spike breaks off, it can't really infect the cell. So one of the earliest mutations that the virus undertook was it made the DNA code, made a protein that was no longer brittle. It was actually kind of flexible. So when it came out of the cell, instead of breaking off, it would just flex, make its way out of the cell and be intact and ready to infect the next cell in your body. So the concern about these variants is they change the virus in such a way that it's better able to move from person to person, or better able to survive the life cycle of the virus being made in your cell and then being extruded. So what we have now is the UK variant, which most of the vaccines that we have now take care of the UK variant. That's the B1.117. But the South African variant has the same mutations as the UK variant, plus 5 other mutations that make it more durable. And so the concern is that the mRNA that is in the current vaccines may not cause your cell to make the right exact zipper to be able to neutralize that virus when your body sees it again. And so Pfizer and Moderna are actually creating a booster shot, which is a third shot, that has a very specific mRNA sequence so that it trains your body to see the South African variant, or trains your body to see this Brazilian variant. So the variation is in the DNA sequence.
All right, thank you. So we're going to continue on with a couple of more questions here. And these questions are related to a few terms that people are hearing a lot in the news or on social media. So they are hearing the term as it relates to getting the vaccine about an adverse event, a reaction, a side effect. If you can clarify those terms.
So they are largely experienced the same, I would say. Adverse event is the technical term that is used inside of clinical trials and studies. And these are events that have to be reported. So they can be anything from itchiness at the site, or swelling or pain at the site, all the way to anaphylaxis, which is a severe inflammatory allergic response, and death. Those are adverse events, but that's just the language we use sort of inside of medicine and healthcare. I would say most people probably describe those as side effects, and then you can grade them from mild to severe. And I gave you an example of the mild ones, like I got a swelling and some arm pain, to severe, I had anaphylaxis or I had to go to the hospital, or death, although that's quite rare with this vaccine.
Yeah, I know that I know, so I've had the vaccine and I experienced some muscle soreness at the injection site and also fatigue. I know there's headaches that people experience, chills, but one thing to note that there's rare cases of severe treatable allergic reactions. And that's why for most people, you have to wait about 15 minutes after you've taken the shot, some 30 minutes.
All right, thank you. Someone else asked, just in your opinion or your advice, are you comfortable that the long-term outcomes are not known and it's unknown if there are threats to our long-term health as a result of taking the vaccines?
Yeah, so this goes back to the question of faith for me, and how certainly we don't know the long-term effects of the vaccine, but the way I see it is that, I'm okay with not knowing the long-term effects and having some slight symptoms versus having COVID itself, just from the experiences that, that I've had with people who've had COVID, some of the long haulers that we know of, and so that's how I make that decision of the long-term side effects.
And then someone also had a question related to what's going on and why are people dying why are some people dying after getting the vaccine, or getting very sick after having a second dose, that's an area of concern for people regarding the vaccine.
So I'm aware of, I believe in Scandinavia, there were a number of octogenarians, so people over 80 and into their 90s who died in relation to the vaccine. But the numbers are very small, and they are, I wouldn't say countable on two hands, but countable on 2 hands and 2 feet, out of a denominator, as we've mentioned, of millions and millions of vaccinations. One of the things is, and the reason that people get side effects, or what they experience as side effects, some of the things that Dr. Butler referred to in terms of fatigue and headaches and gastrointestinal system symptoms, is because your body is doing what it would do if you had COVID. It's trying to fight off COVID. So how terrible you feel is really a direct correlation with how hard your immune system is working to fight against whatever it is that it sees as foreign. So unfortunately, some of these side effects can exacerbate or make worse pre-existing conditions. And I don't mean to say that like, oh, well, only people with pre-existing conditions have to worry. What I'm saying is, if you have heart failure or coronary artery disease, or your high blood pressure, or something that actually, when it's in its worst status, could cause death. The problem is, if you get a really vigorous immune response and you're already elderly and have a number of these comorbidities, then that's what characterizes that cluster of deaths in Scandinavia. So it was really around age combined with comorbidities. And the thing about the virus, one of the things that we don't know, about the vaccine, is we don't know who's going to get, side effects that they can feel or have these experiences. I had the Moderna vaccine. I did get extremely fatigued, and I kind of wasn't remembering that maybe this was associated with the vaccine until I heard someone on the radio talking about having similar side effects. I had a headache. I was extremely fatigued. I felt very dizzy. And I had heard that the second dose of Moderna, that the side effects were worse. Well, I got my second dose and I had 0 side effects. My husband had Pfizer, both shots, no side effects. So it's hard to predict who's going to get these side effects, but they have to be quite severe in order to tip over something else that's already a little bit fragile before we start seeing these deaths. And for the anaphylactic reaction, as Dr. Butler referred to, it is treatable. And typically the people who have had that anaphylactic reaction already have a history of being highly allergic, for example, to peanuts, and carry an EpiPen with them. So they have a history of anaphylaxis to something else, not just the specifically to the virus.
Yeah, I think that was an important point to note that, each one of us experiences it differently. I received the Moderna, no side effects the first shot, highly fatigued the second shot. My mother had Pfizer, no symptoms in either shot. So, I think when we talk about symptoms and side effects, or side effects rather, typically it's the person's experiences, but we are really looking at the clinical trials. And from that study, we found that, most folks had, headaches or fatigue. And so that's, it really varies by person.
The thing that it made me realize is if I got this kind of reaction from a vaccination, it made me think, what would COVID be like in my body? And so I was grateful that it was over in 2 days and that it wasn't COVID.
That's a good point. Certainly a good point.
Yes, thank you for putting some important perspective on that. So let's see, we're going to ask a few more questions here. One question is, how safe is it if I just wait and see what happens to everyone who takes the vaccine, and then maybe get it next year, 2 years, something like that? So somebody wants to find out about the wait and see approach about vaccination.
Well, I'm going to recommend that they pick a number that they're waiting to see, because we're already in the over 20 million people. So there's a lot that, a lot of people have already been vaccinated. The thing about vaccination and just the thing about COVID in general is we're actually being asked to do something we generally don't do sort of as Americans. We're being asked to work together. COVID loves it when we don't work together. So getting a vaccine is not just for you. Yes, it protects you, but it also reduces the ability to spread it. I mean, you can still spread it, but it reduces that capacity. And in order for us to be done with COVID and to be done with the pandemic, and for businesses to get back to where they were, and I just am saying that because most of the businesses that are going under for good are Black-owned businesses. We need to think about the what I call the body politic, like the health of our society and the health of our communities. So if you decide you're not getting vaccinated, it actually just puts other people at risk.
Absolutely. And I know that we're around, faith communities. And I always think about it as from just a human perspective of, we're not able to gather at church. That means that a lot of our seniors are suffering from isolation. And so when you think about, this vaccine, you certainly have to first, again, this is your decision. Think about yourself, but think about the implications it has on folks that you pretty much, are not impacted by, like seniors, those that are health workers, our first responders, those that are on the ground, at the work. This is impacting not only person's health, but their sort of their jobs, ability to get jobs, and other things. And so I would certainly, take a step back and think about how this can impact your community, particularly your church community.
Yes. And someone has a clarifying question about, the question is, if I've already had COVID and I've recovered, can I get COVID again? And is it necessary that I get the vaccine? So they're trying to clarify if they already have some built-in immunity or something as it relates to COVID.
So the answer is, if I had COVID before, can I get COVID again? The answer is yes. You absolutely can get COVID again. And we're just in a period where we're figuring out, after all these variants have been identified, that when people get reinfected, what we're trying to do is get the sample from the first test and the sample from the second test and sequence the virus and say, are these the same? Is it the same virus or not? We haven't done enough of that work to know if you can get infected again with the same virus. We don't know yet, but you can get infected again. And in terms of, well, I've had it, you know, I'm not going to get it again because I have antibodies. That's like the chicken pox, right? That's kind of what we know about the chicken pox. That's not true for COVID, partly because we don't know how long the antibodies last that are developed against the actual organic infection, just your infection and your immune system responding to it. We're not sure if the antibodies last 3 weeks or 3 months. And then we don't know over the long term if the antibodies you have at 3 months, are they neutralizing antibodies? Remember, the job is to gum up that key. So are they actually neutralizing, or are they just floating around and detectable in your system, but not functional? So you will not get immunity just because you've been infected before.
Okay, there was a couple of questions related to a COVID vaccine for being available for children. Is there something on the horizon for children? And then also piggyback on that question is, if someone has heard about the vaccine having the potential to cause birth defects. So the first part is related to a vaccine being available for children or not, and whether or not COVID vaccines are causing birth defects or has the potential to cause birth defects.
I think the birth defects thing probably comes from the old literature about vaccines and autism, which got a lot of attention and traction before the research was actually removed from the literature and debunked and the researcher discredited. So we don't know if it causes birth defects because there's not enough data in terms of pregnant women being involved in the studies. And I think someone had asked that in the Q&A. We don't have enough data yet to say for sure that it's safe for pregnant women and safe for the fetus. And I'm sorry, what was the second part of that?
The second part was related to, will there be a vaccine for children or?
Yeah. The trials didn't involve kids under 16. I think there's 2 different ages for Pfizer and Moderna, but it's somewhere around 16. So we don't yet on that. I don't know if the Johnson & Johnson trials included young people, but the only way we can really say it's safe for kids is actually to pull out what's probably going to happen is all of the data will be pulled out for any of the young people who are in any of the trials, and all of that data then analyzed together, because in any one trial, you don't have enough kids to actually make conclusions about whether or not it's safe at this point.
Okay, so more to come on that, that particular aspect.
And I do know on the Moderna vaccine that there were some women who became pregnant during the actual trial or the study. And 18 of those women were in the vaccine group, I believe. And 2 months later, no one had miscarried. So, but again, as Dr. Rhoads had mentioned, we haven't been able to study pregnant women, but I think it's on the horizon.
Okay, so more to come. We're still waiting for more to come on information related to that particular area. Okay, so the next kind of couple of questions are a mix mash of things, but one of them is related to, if I go ahead and have my first shot and for some reason I'm not able to make it for a second shot, what does that mean, or what effect does that have on vaccine effectiveness?
Well, that's another we don't know, because the way the studies were designed, the people got 2 shots and were analyzed as if the data was analyzed as if they got the 2 shots on time. So it hasn't been studied that way. And I know that people are probably hearing now on the news, there's some argument for getting everybody at least one shot to get more people at least partially immune, rather than preserving the shots for the second shot to make sure a smaller group of people are fully immune. And that battle is not settled. But what I would say is, if we're going to say we trust the science, we have to look at how the studies were designed, and we have to follow the recommendations that come from the study, because those are the only numbers that we can tell you for sure we know out of hundreds of thousands of people that the vaccine works by giving 2 shots at a particular interval. And I just want to add one more thing, because I have seen people on social media saying they got the first shot, but they don't know when their second shot is going to be. Typically, when you get your first shot, the second shot is discussed and scheduled, or at least the dates are looked at. So if you're not getting that, you should ask for that.
And I also want to add, because I found that actually a lot of people think that they're protected immediately after they get the shot. But I think it's good to note that the protection doesn't begin to become apparent until about 10 to 14 days after your first shot. And then between your first and second shot, you're 50% likely to not get COVID. And then once you get your second shot, then you have to wait an additional 10 to 14 days for the full effectiveness, which is the 94, 95%.
Okay, so folks still need to practice public health practices of keeping social distance, masking, washing their hands, etc., even after they've gotten the vaccine. So there was a question here that I guess it would tie into a potential side effect that someone heard about. And that is COVID-19 having an effect on the brain and on brain health? Does anyone have an answer to that?
COVID-19 or the vaccine itself?
The person didn't specify if it was the vaccine. They just left it as COVID-19.
So that I mean, I think that's actually important, because what we're talking about the vaccine, we haven't really talked about what COVID does in the body. And there's been a lot of emphasis on the lungs and COVID causing pneumonia. But the reality is COVID is an inflammatory process. So whichever cells it infects, it just causes a huge inflammatory reaction around it. And unfortunately, one of the types of cells that it infects are the cells that make up your blood vessels. And so it can cause a lot of inflammation in the blood vessels. And when you get inflammation in the blood vessels, the organs that the blood vessels are trying to bring oxygen and blood to don't get enough of oxygen or blood. So yeah, you can have strokes. There have been aneurysms reported, and those strokes actually were in quite young people in the 20s and 30s. The rash-like syndrome, the Kawasaki syndrome that we were seeing in young kids for a period of time early in the pandemic, that's a vasculitis. And what they were getting was the blood vessels around the heart would actually rupture. And so yeah, it can cause brain effects. And then one of the long hauler symptoms of people who have recovered from COVID is brain fog. We don't know exactly why that is, but it does suggest, again, that there's some effect on brain tissue or blood supply to the brain.
Okay, well, thank you. We have a couple of other odds and end questions before I turn it back over to Carmen. And one of the questions someone wants to ask is, what exactly is herd immunity?
I just saw something in the Q&A asking if it's a valid concept. Yes, herd immunity is what we get when we vaccinated everybody for measles, mumps, and rubella and diphtheria. And remember, when people stopped vaccinating for pertussis, then all of a sudden you saw people starting in an area where the vaccinations were low, you see people getting pertussis. So herd immunity is this idea that if most people are immune, then the spread and transmission of the virus will slow down significantly. And what it requires is about 60 to 70% of the population to have immunity against the infectious agent. Then the other 30% are roaming around, but it's harder for them to spread it to anybody because 7 out of 10 people they come into contact with are immune already. So the goal is herd immunity by vaccination to get everybody, to get a high number of folks immune. The way it was being used in the beginning of the pandemic was this idea that just let everybody get infected and then nobody will get infected. But what we know about COVID is you can get reinfected. So that doesn't, natural herd immunity without vaccination isn't going to work for COVID.
Okay, and kind of in a related question to that, someone is asking, can taking vitamin D, vitamin C, and eating mushrooms be preventive or prevent you from getting COVID?
No evidence in that. But I do think that it's important to note here in terms of prevention that there are things that you can continue to do. As we know that there's positive behavioral practices that everyone should sort of take heed to, which is, certainly, working out and eating properly, getting the correct amount of sleep. In addition to that, you should add to that best practice, getting the vaccine. But I think that, I get a lot of questions about, taking vitamins. Certainly do that if you feel as if you should take vitamins, if your doctor has sort of mandated you take vitamins, certainly you do those things. And that, those are the things that we do regardless of if we're in a pandemic or not. So I do think that it's important to note that there are preventative measures that may not prevent you from getting COVID, but you certainly should continue to do.
I think the vitamin D thing is coming up because of the absorption of vitamin D from the sun is reduced in people with darker skin. There are actually a couple of papers that suggest that there may be a benefit. This is the problem, because there's a couple of papers that suggest there's no benefit. So what we're left with is a dilemma, because you could say, well, I saw that paper, it looked like it was scientific, right? But that's one out of many. And right now we're in a complete conflict about vitamin D. There's no definitive paper that shows that it works to prevent COVID. And there's no definitive evidence that it doesn't work. So if you take it, not gonna hurt you, but don't count on that as your COVID prevention.
Okay, well, I'm gonna turn it over to Carmen, who will address some of our questions that have been coming up live in our Q&A if we haven't already answered them. Thank you.
Okay, thank you, Michelle. Some of the questions that are coming up live, portions of them have already been answered, but I'm going to go ahead and try to put them in context based on what we've already heard. We did discuss that there were women who had gotten pregnant along the line, during the trials. But this question is, this person says, I'm pregnant. Is there data to support the vaccine being safe for the baby and mother? Should I get the vaccine? I'm pregnant.
I would say that's a direct consultation with OBGYN provider and primary care provider to make an informed decision that is based specifically on the person, their pregnancy, their health overall. There's no blanket statement to be made yet because we just don't have enough data.
Thank you. The next question is from Dr. Rena Pasic. She says, when vaccination sites are set up in neighborhoods where people of color live, how can folks verify that these are legitimate sites?
So as I mentioned before, everybody who gets vaccinated gets a little card that has proof of vaccination. I would probably ask a bit about, what vaccine is being given and then where the vaccine is coming from, like who ordered the vaccine. So the all physicians and other providers of COVID vaccination have to be registered with the state. And so you can actually check. So there has to be a physician name that is attached to it because that's how the orders get made. So you need to ask, what's the source? Is this the Department of Public Health? Is this my primary care provider? Is it Kaiser Sutter? You name it, UCSF. And if it's a community-based organization, then you'll want to know who's on the back end, who's the ordering provider here. And if you can't get an easy name with that ordering provider and you don't see that on your little card, then you should be suspicious.
Thank you.
Certainly, whenever you're suspicious, ask questions, ask questions, ask questions, and don't be inclined to take it if you're not comfortable, and wait until you get your questions answered.
I'd like to add, for community-based vaccination sites, hopefully when we get really wrapped up into that, know the partners that the vaccination officials are working with. Are they working with a trusted organization? The church, a community organization like the Oakland Frontline Healers. Do you know those people that are supporting them being there? And if you don't, add on the other piece. Who's the doctor behind it? Is it the health department? Is it UCSF? Where are these people coming from? What makes them trusted in my community?
We've had another question to pop up.
I'm
sorry.
sorry. There is a sort of a, I mean, this is going to get tricky as we try to be more accommodating and pull down barriers for community to really get good access. But there'll be a sign up portal, because that's the way, even if you get put in that portal when you come on site, because that's the way your next dose date gets generated. So if somebody just says, come on in, let's give you a shot, and then you go, then you know that's not a place you want to be getting your COVID shot.
We have questions popping up everywhere. Let me see if I can find the next one. The next one is, why have we not gotten more information about deaths from the vaccine? I've heard that it can happen.
Well, you're not getting much information about it because there are so few of them that do happen. And they have been reported, the news media is really reporting a lot of them. And in the beginning, in the first few days of the Pfizer rollout, somebody did have an anaphylactic reaction and did die. But again, when you're looking at 22 million people have been vaccinated, the deaths from vaccination don't get covered up because actually they make great stories for the news media. So you are going to hear about those deaths. There just haven't been that many in America.
Okay. I don't remember if this question was asked, but how long do we know how long the vaccinations actually last? This person said, I've heard that they're only good for 3 months.
Yeah, certainly we don't have the data for the long-term impact on the vaccine. And that's just the best we can say. Like, we just don't have that information. And again, it goes back to this, faith talk about, we have, only time will tell. And so, yeah, that's all I have.
Okay. This person is asking how long and how they should protect themselves after getting vaccinated. Should they continue to wear masks, and are they able to travel after the first shot?
So oh, go ahead.
No, go ahead. We're going to say the same thing, probably. Certainly. I have, I've been extra cautious, actually. And I'm not sure why, but I'm certainly, I don't go out a lot. I still wear my mask. I still wash my hands. I still physically distance. If I'm even in the grocery store and there's too many people there, I'll just immediately leave. So those are the things that you will have to continue to do. Even after you've taken, I'm supposedly 95% protected, and I'm still taking precaution. And there's a reason for that, is because I don't know whether or not I can actually still pass COVID if I contract COVID. And so I want to make sure that I take as many precautions as possible.
That's a question that has not been asked, so I'm going to ask it, and that is, after you've had the vaccinations, part 1 and part 2, can you still pass COVID? Being perhaps asymptomatic or whatever would be the process, can you pass it on to family members if you've gotten your vaccination?
So with Pfizer and Moderna, the answer is yes. There's some indication that Johnson & Johnson may actually reduce your ability to transmit it and actually stop the transmission of the virus. But and I think that's an important point to make. I mean, these vaccines were not studied with the question, does this prevent you from ever getting COVID? What they were studied with as an endpoint is, can this prevent you from getting severe COVID, having to go to the hospital, and potentially dying from COVID? So I just think that's important for people to understand. So yes, because it reduces the severity of disease, then you might be asymptomatic and have it, and therefore you could pass it. But again, Johnson & Johnson, they are looking at whether or not it stops the transmission, and it's looking like it may.
This is sort of a general question. Is there anyone in general who should not get the vaccine?
I don't have a blanket answer for that. Categories of people who should not get it. Well, the folks who have not been studied or their sort of characteristics represented in the trials. But again, this is a conversation between your primary care provider, who knows your list of what's going on, and you making a decision about what the risks are. Because the reality is, it's a matter of what additional risks are associated if there are other underlying conditions that people are worried about.
We've touched on this from several different directions, but I think it's really important to just ask it directly again. And that is, this person says, ACOG has stated that they encourage pregnant women to get vaccinated because they are a high risk population. Can we clarify that?
So that's the American College of Obstetrics and Gynecology. So that must be their ACOG. That must be their professional recommendation. I'm not familiar enough with that recommendation. I'm more familiar with the debate and maybe just the general response to the fact that pregnant women were not represented in the studies. So again, that's one where you really have to have a heart-to-heart with your primary care provider about whether or not you wait until you're done with your pregnancy.
This question is there anyone liable if something goes wrong?
Liable meaning who would get sued?
Yeah, I think that's what the question is.
Gosh, I honestly don't know the answer to that. I imagine it would be the manufacturer, but it would depend on, what the reason for the suit is. A gigantic hematoma that, causes some skin loss, which is really, I'm making this up, being very dramatic. That might have something to do with the injection, but other than that, it's about the manufacturer. And that's also why when they give you that little card, they write down which lot number, right? So the manufacturer can go back and say, was there something wrong with this particular lot number? That's why they record that when you get an injection.
Okay. Now we're coming to the end of the time where we can continue with our questions, but we wanted to make sure that our physicians had a chance to give us their top takeaway points before we close the questioning. So I want to give each of you an opportunity to do that. And we'll start with Dr. Butler. Is there anything that perhaps was not asked or anything that you in particular want to make sure that we have heard before we close out our session?
Certainly, I think what's important for me is that everyone has to make the decision for themselves whether or not they want to get vaccinated. And it's just, I'm not a physician. I consider myself a health professional. It's our job to provide you with the information to, again, help you to make the most informed decision that you can. And I also would think, I would say also, again, the question I ask myself, what is sort of the risk of actually getting COVID versus the benefit of actually getting the vaccine? And you have to ask yourself that question in making that decision. And I think that's what's been stated also, is the importance of talking with your primary care physician before you make that decision. I've done that. Everybody that I've spoken to, I've asked them to do that. And I encourage everyone, before you make the decision, make sure you get the right information, because there's a lot of misinformation and disinformation out there. And then talk with your doctor. You may want to discuss it with your family before making that decision. And then lastly, I'll say, just know that this is a faith journey and that there are a lot of things that we don't know, but just continue to have the faith.
Thank you, Dr. Butler. And Dr. Rhoads.
The thing that I wanted to point out is a couple things. One is, as I mentioned before, the vaccine's job is to reduce your risk of dying from COVID. That's really what the vaccine was studied to do. And what we know both in San Francisco and Alameda County, and I'm sorry for those of you who are on the call from outside of those areas, I don't know the numbers, but when we talk about infection, we know that across California, for the most part, it's higher in the Latino, Latina, Latinx community. It's not as high in the African-American community, which is a good thing. But when we look at death, severe COVID and death, that's higher in the African-American community. So even though most things in healthcare are not for us, this vaccine is actually for us. Not created for us, it was not intentional, but it addresses the experience of Black people with COVID. And so I just want to encourage everyone to really think about, and again, get comfortable with this idea, because most things aren't for us. And when we're first, it feels uncomfortable. But this is a time when actually, if you feel confident enough, step up and get in line and roll up your sleeves, because this is for, this is the thing that is going to have an impact on outcomes for our community. And like I said, I don't think it was intentional, but it matches to what we need to survive this pandemic.
Wow, that's really important. As we close this session, I just wanted to let everyone know that it was recorded, and so it is going to be posted. The recording is going to be located on the Office of Community Engagement website, the Office of Community Engagement. And I believe that you will probably get a link to that so that you can listen again to all of the questions, all of the answers. We want to thank all of you for participating, particularly our wonderful physicians and also our partners, UCSF and San Francisco Foundation. Michelle, did you have any last words before we close out?
Yes, I did want to remind folks that we did put the link for the Office of Community Engagement in the chat for you if you want to capture that to check back in a few days for the recording. We also immediately when you disconnect, you're going to be receiving an email just to sort of ask you for some feedback on today, and also ask if you're interested in another session building on what was here and when. So check those out and please respond to those so we can capture your feedback. And then also if you missed something or you want to share what was shared today with someone else, you'll be able to pass that on in a couple of days. And again, thanks to everyone, Dr. Rhoads, Dr. Butler, our planning team, Wilma Batiste, Marian Harris, Nicole Pope, Cassandra Bailey, and the San Francisco Foundation, Faith and Carmen. Thank you so much.
One last thing. As we close out, we're going to close out with the art of a young 11-year-old artist. Her name is Ariane Howard, and she has written a beautiful song about her experiences and community experiences with COVID-19. So before you click off and go, Brian, we'd like you to start that song, and I hope you get a chance to hear a little bit of it before you leave. And thank you again, everybody. It was a wonderful session. Bye-bye. Is it there, Brian?
You got it, Michelle? I think Michelle's going to share it.
Okay. Thank you, Michelle.
Do you have it, Michelle, or are you sharing your screen? I can probably do it.
Coronavirus. Ooh, it's Queen Ariane on the beat, yeah. Get it? Coronavirus. 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 Hey, put your mask on. It's a virus in town. Coming all the way from China and it's about to go down. Going crazy in the stores cause we all locked down. But stay 6 feet apart cause the rona in town. And the scientists still trying to find a vaccine. Don't forget to wipe your counters. Gotta keep them real clean. And we bored in the house doing quarantine things. I said we bored in the house doing quarantine things. Coronavirus. 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 Coronavirus, coronavirus. And this virtual school got me acting the fool. Doing online work got me going berserk. TikToks all day, and you know I don't play. And when I'm done with that, I'ma play some board games. Coronavirus, 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 coronavirus. You got people dying every day, corona don't play. So wash your hands with some soap and keep the rona away. People tearing up the streets, no justice, no peace. R.I.P. to Chadwick Boseman, we just lost the real king. The first black superhero to hit the mainstream. Now it's up to all of us to continue his legacy. And it's Wakanda forever, cause I'm a young black queen. And that was just a quick story of COVID-19. Coronavirus, 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 hey.
Thank you, everybody. Have a wonderful evening. Bye-bye.